What are some effective coping strategies for managing cravings during relapse prevention, and how can these be integrated into a recovery plan for a client in early recovery? Answer: effective coping strategies for managing cravings during relapse prevention involve a combination of psychological, behavioral, and environmental techniques. Cognitive behavioral therapy (CBT) is widely used to help clients identify and challenge maladaptive thoughts and behaviors. This could include cognitive restructuring to reframe cravings as temporary and manageable. Additionally, distraction techniques such as mindfulness meditation, engaging in physical activity, and calling a sponsor or attending support group meetings, e.g., 12-step or SMART recovery, can be beneficial. Support groups provide a sense of community and reinforce accountability, which is crucial for maintaining long-term sobriety. Integration into a recovery plan should include the use of coping strategies on a daily basis with periodic evaluations to assess their effectiveness and make adjustments. Incorporating the stages of change model, Prochaska and DiClement, can help guide these interventions, ensuring that strategies are appropriate to the client's stage in the recovery process. What are the key developmental considerations when treating adolescents with substance use disorder, and how do these affect the treatment plan? Answer: adolescents with substance use disorder (SUD) present unique developmental challenges that require tailored interventions. Key considerations include brain development. Adolescents have developing brains, particularly the prefrontal cortex, which affects decision-making, impulse control, and long-term planning. Interventions should focus on enhancing executive functioning through skills training and supportive therapy. Peer influence. Adolescents are particularly susceptible to peer pressure, so family therapy and social skills training are essential for reinforcing positive behaviors and resisting peer-related triggers. Emotional and identity development. Adolescence is a critical period for identity formation. Treatment should incorporate motivational interviewing to help the adolescent understand the consequences of their behaviors and build intrinsic motivation for change. Risk-taking behavior. Adolescents tend to engage in risk-taking, so harm reduction strategies and behavioral contracts should be employed to mitigate risks and help the adolescent make safer choices. What role do support groups, such as 12-step programs or SMART recovery, play in relapse prevention, and how can a nurse guide a client to engage with these resources effectively? Answer: support groups like 12-step programs and SMART recovery play an essential role in relapse prevention by providing a structured environment where individuals can share experiences, receive encouragement, and maintain accountability. 12-step programs such as Alcoholics Anonymous or Narcotics Anonymous emphasize spiritual growth, fellowship, and steps for personal accountability, which help individuals focus on their recovery journey and develop a network of sober peers. SMART recovery, in contrast, is a secular, evidence-based program that emphasizes self-empowerment, cognitive behavioral techniques, and problem-solving skills. The nurse's role is to guide the client to the appropriate group based on the client's personal beliefs and preferences. Nurses can facilitate engagement by normalizing participation in support groups, explaining their benefits, and helping clients overcome initial barriers, e.g., shame, fear. In addition, they can help integrate referrals into a comprehensive recovery plan. Nurses should also emphasize the importance of regular attendance and active involvement in these programs for sustained recovery. Mr. Johnson has been sober for 6 months after completing inpatient treatment. Recently, he started feeling overwhelmed with stress at work, leading to increased thoughts of using alcohol again. He has attended a few 12-step meetings but has not been consistently engaged. What strategies should a nurse recommend to Mr. Johnson to prevent relapse in this situation? Answer: in this scenario, the nurse should implement a comprehensive relapse prevention strategy that addresses both the environmental stressors and the client's emotional triggers. The following strategies are recommended. Coping skills training. The nurse should teach Mr. Johnson specific stress management techniques such as deep breathing exercises, progressive muscle relaxation, or guided imagery to help him cope with work-related stress. Cognitive behavioral therapy (CBT). Encouraging Mr. Johnson to engage in CBT will help him identify and challenge any irrational thoughts related to using alcohol as a coping mechanism for stress. Increased support group participation. Since Mr. Johnson has not been consistently attending 12-step meetings, the nurse should emphasize the importance of regular attendance at meetings to enhance his sense of community and accountability. He could also be encouraged to find a sponsor who can provide one-on-one support during challenging times. Relapse prevention planning. The nurse should review and revise Mr. Johnson's relapse prevention plan, ensuring it includes clear strategies for coping with specific stressors and triggers, e.g., work stress. The plan should include contacting a sponsor or attending a meeting when cravings arise. What is the role of family involvement in relapse prevention, and how can a nurse effectively include the family in the recovery process? Answer: family involvement is critical in relapse prevention as family dynamics often play a significant role in the development and maintenance of substance use disorders. Involving family in the recovery process can enhance support systems. Family members can provide emotional support, encouragement, and accountability, which are essential during the recovery process. Address family dynamics. The nurse can assess and address dysfunctional family patterns, e.g., enabling codependency that may contribute to the client's substance use. Techniques such as family therapy or family education about addiction can help alter these patterns. Encourage communication. The nurse should guide the family to develop healthy communication skills, helping them express concerns without enabling destructive behaviors. Family involvement should be encouraged at every stage of the recovery process, with the nurse facilitating regular family meetings, offering educational resources, and encouraging open dialogue. This integrated approach helps build a stronger support network for the client, reducing the likelihood of relapse. Explain how long-term recovery maintenance differs from initial recovery and what are the key strategies a nurse should emphasize for sustaining sobriety in the long term. Answer: long-term recovery maintenance differs from the early stages of recovery because the focus shifts from active treatment and crisis management to ongoing self-care, life management, and preventing relapse. Key strategies include relapse prevention. As clients move past the initial phase of sobriety, they must continue to use relapse prevention strategies, e.g., mindfulness, avoiding high-risk situations while strengthening their sense of self-efficacy, regular support group participation. Ongoing engagement with support groups and continued use of sponsors is essential for maintaining long-term sobriety. 12-step meetings, SMART recovery, or other support structures should remain a regular part of the recovery routine. Mindfulness and emotional regulation. As recovery progresses, clients should develop mindfulness and emotional regulation skills to deal with ongoing stressors and emotional challenges without resorting to substance use. Healthy lifestyle choices. Nurses should encourage the adoption of healthy routines, including exercise, proper nutrition, and regular sleep. These factors contribute to physical and emotional well-being, making it easier to maintain long-term sobriety. How do addiction and homelessness intersect, and what unique challenges do individuals experiencing homelessness face when attempting to recover from addiction? Answer: addiction and homelessness often intersect due to socioeconomic factors, trauma, and mental health issues. Individuals who are homeless may face significant barriers to recovery, including lack of stable housing. Without stable housing, it is difficult for individuals to maintain a consistent recovery routine, attend therapy, or participate in support groups. The absence of safe, stable housing often exacerbates addiction and mental health issues. Chronic stress. The constant stress of survival in a homeless situation can perpetuate substance use as a coping mechanism. Additionally, the trauma experienced by many homeless individuals, e.g., abuse, violence, further complicates recovery efforts. Limited access to care. Homeless individuals often have limited access to addiction treatment services and healthcare, which can delay recovery and lead to repeated relapses. Addressing these challenges requires an integrated approach that includes temporary housing, mental health care, and addiction treatment services. Nurses must advocate for systemic change to provide comprehensive care, including harm reduction strategies, housing-first programs, and trauma-informed care. What are the main considerations when addressing addiction in elderly populations, and how do these considerations influence treatment approaches? Answer: addiction in elderly populations presents unique challenges that require a specialized approach. Key considerations include age-related health issues. Older adults often have multiple chronic health conditions and may be taking medications that interact with substances. The nurse must assess for polypharmacy and the potential risks of substance interactions. Isolation and loneliness. Many elderly individuals suffer from social isolation, which can lead to depression and substance use as a coping mechanism. Treatment should address social support and encourage participation in community activities. Cognitive decline. Cognitive impairment is common in older adults, which can affect their ability to fully engage in traditional addiction treatments. Treatment plans should be adapted to account for cognitive limitations and may involve simplified interventions or support from caregivers. Stigma and denial. Older adults may experience a significant amount of stigma around addiction, which can delay help seeking. Nurses should provide non-judgmental care, encourage open communication, and use motivational interviewing to reduce denial and ambivalence. What role does gender play in addiction treatment, and how should treatment for women address their unique needs and challenges? Answer: Gender plays a significant role in addiction treatment, particularly for women who may face unique social, psychological, and physiological challenges, trauma and victimization. Women are more likely to have histories of trauma, e.g., domestic violence, sexual abuse that contribute to substance use. Treatment should be trauma-informed, with a focus on healing the emotional wounds that underlie addiction, hormonal and physiological differences. Women's bodies process substances differently than men's due to hormonal fluctuations and other physiological factors. Treatment plans should account for these differences, particularly in terms of medication dosing and withdrawal management. Caregiver roles: women are often primary caregivers, which can lead to feelings of guilt or stress when seeking treatment. Gender-responsive care should include strategies for balancing family responsibilities with recovery goals. Social stigma: women may experience more stigmatization than men regarding addiction, which can hinder treatment engagement. Nurses should create a supportive, non-judgmental environment that fosters trust and openness. What are the implications of addiction in EEQ populations, and how can nurses provide culturally competent care for clients in this group? Answer: addiction in ETQ populations is often compounded by unique stresses such as discrimination, rejection, and internalized homophobia. These factors can increase vulnerability to substance use. Nurses can provide culturally competent care by creating an affirming environment. Nurses should ensure that the care environment is inclusive and non-judgmental, using the correct pronouns and fostering respect for the client's sexual orientation and gender identity. Addressing mental health. Mental health issues, such as depression and anxiety, are more prevalent in EEQ populations, which often correlate with substance use. Co-occurring disorder treatment should be incorporated to address both addiction and mental health concerns. Trauma-informed care. GTQ individuals have experienced trauma related to their identity, discrimination, family rejection. A trauma-informed approach helps to avoid re-traumatizing clients while addressing the underlying causes of their addiction. Engaging support networks. Nurses should encourage clients to engage in EEQ-specific support groups that provide safe, shared experiences and a sense of community. These groups can help reduce the isolation that often exacerbates substance use. What are the key challenges in diagnosing co-occurring disorders, dual diagnosis, and how should addiction nurses address them in a clinical setting? Answer: co-occurring disorders, also known as dual diagnosis, involve the simultaneous presence of a mental health disorder and a substance use disorder. Diagnosing these disorders presents several challenges, including the overlapping symptoms of addiction and mental health conditions, which may obscure the diagnosis. Symptoms such as mood swings, irritability, and cognitive impairment can be attributed to either the mental health condition or the substance use disorder, leading to misdiagnosis or delayed treatment. In clinical settings, addiction nurses should be trained to identify and distinguish between the two disorders. They must conduct thorough assessments utilizing screening tools such as the Integrated Dual Disorder Treatment (IDT) model and ensure a comprehensive evaluation that considers both mental health and addiction history. The key approach in managing dual diagnosis includes collaboration with mental health professionals, offering integrated treatment models that address both conditions simultaneously. According to the Substance Abuse and Mental Health Services Administration, SAMHSA integrated treatment results in better patient outcomes, reducing relapse rates. Explain the ethical principle of autonomy in addiction nursing and provide an example of how this principle could guide decision-making in a dual diagnosis patient. Answer: autonomy in addiction nursing refers to respecting the patient's right to make their own decisions about their treatment as long as they have the capacity to do so. This principle is vital in addiction care as it supports a patient-centered approach, allowing individuals to have control over their recovery process. For example, a dual diagnosis patient with depression and substance use disorder may refuse a specific treatment plan recommended by the healthcare provider. In this case, the nurse should honor the patient's decision if they are capable of making an informed choice. However, if the patient is at risk of self-harm or suicidal thoughts due to their condition, the nurse has a responsibility to balance autonomy with beneficence, doing what is best for the patient and non-maleficence, avoiding harm. In this scenario, the nurse would need to intervene to ensure the patient's safety, potentially involving a psychiatric evaluation and reassessing the patient's capacity to consent. The ethical framework guiding autonomy in nursing is rooted in the Nursing Code of Ethics, particularly Principle 1.5, which emphasizes the importance of informed decision-making and respect for patient choices. Mr. Martinez, a 45-year-old male with a history of alcohol dependence and generalized anxiety disorder, is admitted to your facility for treatment. During the assessment, he reports experiencing increasing anxiety symptoms. What should you consider as an addiction nurse, and what integrated treatment approach would you recommend? Answer: as an addiction nurse, the first consideration should be the symptom overlap between alcohol dependence and generalized anxiety disorder care. Alcohol withdrawal symptoms can mimic or exacerbate anxiety, making it difficult to distinguish between the two conditions. It is crucial to perform a thorough mental health and substance use assessment, including evaluating his history of alcohol use, withdrawal symptoms, and any psychiatric interventions. The recommended integrated treatment approach should focus on concurrent treatment for both the substance use disorder and the anxiety disorder. Evidence-based models like cognitive behavioral therapy (CBT) for GAD combined with motivational interviewing and contingency management for addiction treatment are effective. Medication-assisted treatment MAT using SSRIs, fluoxetine for anxiety and disulfiram or acamprosate for alcohol dependence may also be considered. Collaboration with a multidisciplinary team, including psychologists, psychiatrists, and social workers, is essential to ensure coordinated care, improving both short-term and long-term outcomes for Mr. Martinez. Discuss the ethical implications of breaching patient confidentiality in addiction nursing, specifically in cases where a patient poses a risk to themselves or others. Answer: patient confidentiality is a fundamental principle in addiction nursing, governed by laws such as the Health Insurance Portability and Accountability Act (HIPAA) in the U.S. However, there are exceptions to this rule, especially when a patient poses a risk to themselves or others. If a patient is exhibiting suicidal tendencies or is engaging in behaviors that could harm others, the addiction nurse must balance the duty to maintain confidentiality with the duty to protect life. According to HIPAA privacy rule and the American Nurses Association on a code of ethics, in such cases, a breach of confidentiality may be ethically justified under the principle of non-maleficence, avoiding harm. The nurse must report the situation to appropriate authorities or healthcare providers, such as psychiatric professionals, to ensure the patient receives immediate intervention. The decision should be guided by clinical judgment and an understanding of the duty to warn and duty to protect, ensuring that the risk of harm outweighs the need for confidentiality. A patient in your care has been diagnosed with depression and opioid use disorder. The patient is resistant to medication-assisted treatment (MAT) for their addiction. What strategies can you employ to address their resistance while respecting their autonomy? Answer: when a patient is resistant to medication-assisted treatment (MAT) for opioid use disorder, addiction nurses can employ several strategies that respect the patient's autonomy while encouraging treatment compliance. These strategies include building rapport. Establishing trust and demonstrating empathy is key to overcoming resistance. Nurses should create a non-judgmental environment and provide the patient with emotional support, education, and informed choice. Provide the patient with information about the benefits of MAT, including how it can improve their quality of life and reduce the risks associated with opioid use. This empowers the patient to make an informed decision. Motivational interviewing MI techniques can help identify the patient's intrinsic motivations and resolve ambivalence. The nurse should focus on exploring the patient's concerns and values regarding treatment, addressing misconceptions about MAT, and collaboratively setting goals for recovery. Collaborative treatment planning, involving the patient in the treatment planning process, gives them a sense of control and ownership over their care. The nurse should discuss all available options, including MAT alternatives, and tailor the plan to meet the patient's needs. Explain how the principle of beneficence should guide the nurse's actions when treating a patient with both schizophrenia and a history of substance abuse. Answer: beneficence, the ethical principle that requires healthcare providers to act in the best interest of the patient, is crucial when treating patients with dual diagnoses such as schizophrenia and substance abuse. The nurse must ensure that the treatment plan addresses both the mental health condition and the substance use disorder simultaneously, as treating one without the other can lead to incomplete care and higher rates of relapse. In this case, integrated treatment is essential. The nurse should collaborate with a multidisciplinary team to create a comprehensive care plan that combines antipsychotic medication for schizophrenia with substance use treatments such as cognitive behavioral therapy (CBT) or motivational interviewing (MI). This approach is supported by evidence showing that integrated care improves long-term outcomes for patients with co-occurring disorders. According to SAMHSA's Treatment Improvement Protocol, TIP 42, the nurse should focus on holistic care that minimizes harm, maximizes therapeutic benefit, and respects the patient's autonomy while promoting long-term recovery. Mrs. Harper, a 60-year-old woman, has been diagnosed with PTSD and alcohol use disorder. She has a history of self-harm and suicidal ideation. What should be the nurse's immediate course of action to ensure her safety? Answer: in this case, the nurse must prioritize patient safety. Given Mrs. Harper's history of self-harm and suicidal ideation, immediate steps should include risk assessment, conducting a thorough risk assessment to determine the severity of her suicidal ideation and self-harm behaviors. This involves asking direct questions about her thoughts, intentions, and plans regarding self-harm or suicide. Engage mental health professionals. Because of the dual diagnosis of PTSD and alcohol use disorder, it is essential to involve psychiatrists or psychologists in her care to ensure that her treatment addresses both her trauma history and addiction issues concurrently. Monitoring and supervision. The nurse should ensure close monitoring, either on a psychiatric unit or with regular check-ins to prevent harm. If necessary, the nurse should initiate emergency protocols, such as hospitalization or referral to a crisis intervention team. Create a safety plan. Work with the patient to create a safety plan, including coping strategies and emergency contacts, and ensure she understands the importance of reaching out for help if she feels at risk. In what ways does a therapeutic alliance benefit addiction treatment, and how can addiction nurses foster such an alliance in patients with co-occurring disorders? Answer: a therapeutic alliance. The relationship between healthcare provider and patient is critical in addiction treatment, particularly for patients with co-occurring disorders. It fosters trust, promotes engagement in treatment, and improves adherence to treatment plans, leading to better patient outcomes. Addiction nurses can foster a strong therapeutic alliance by building rapport, establishing trust, and demonstrating empathy toward the patient, particularly for individuals with dual diagnosis who may have experienced stigma or past treatment failures. Active listening. Nurses should provide the patient with a space to express their concerns, fears, and goals, which helps in developing a collaborative treatment plan. Consistency and reliability. By being consistent in their interactions and providing reliable support, nurses can reinforce the patient's sense of security and encourage their participation in recovery. Respecting autonomy. In addition to emotional support, respecting the patient's decision-making process allows the patient to feel empowered and more likely to engage in treatment. How does the principle of justice apply to addiction care, particularly in the allocation of limited resources or in providing care to marginalized populations? Answer: the principle of justice in addiction nursing refers to the fair and equitable distribution of healthcare resources, ensuring that all patients, regardless of their background or socioeconomic status, have access to the care they need. In addiction care, justice requires nurses to ensure equitable access to treatment, especially for marginalized populations such as those from lower-income backgrounds, ethnic minorities, or rural areas who may face barriers to accessing care. Advocate for systemic change to address disparities in addiction care, such as limited access to mental health services or medication-assisted treatment (MAT) programs. Fair treatment of all patients, ensuring that each patient receives care based on their needs rather than on biases or stereotypes. The ANA Code of Ethics, Provision 8, emphasizes the role of nurses in advocating for social justice, particularly in ensuring that marginalized or vulnerable populations receive appropriate and fair treatment in addiction care. Explain the role of informed consent in the treatment of addiction, and describe how addiction nurses should ensure that consent is properly obtained and documented. Answer: informed consent is a fundamental ethical and legal requirement in addiction treatment. It ensures that patients are fully aware of their treatment options, including the risks, benefits, and alternatives, and that they agree to treatment voluntarily. Addiction nurses must provide clear and comprehensive information to the patient about the nature of their condition, treatment options, potential risks, and benefits. The information should be presented in a way that is understandable to the patient, considering factors such as literacy and cognitive ability. Assess the patient's capacity to consent. Ensure that the patient has the mental competence to make informed decisions. If the patient is unable to provide consent, a legal guardian or next of kin may need to provide it. Document the process. Proper documentation of the informed consent process is crucial. The nurse should ensure that the consent form is signed and that any discussions about the treatment plan are clearly recorded in the patient's medical record. Explain how the stages of change model, trans-theoretical model, can be applied to an addicted patient who has been resistant to treatment for several years. Include a detailed analysis of how nurses can assist the patient at different stages and what interventions are effective in each stage. Answer: the stages of change model, also known as the trans-theoretical model, involves 5 key stages: pre-contemplation, contemplation, preparation, action, and maintenance. For an addicted patient who has been resistant to treatment for years, the nurse's role is to assess which stage the patient is currently in to provide appropriate interventions. Pre-contemplation. In this stage, the patient may not see a problem or is unaware of the consequences of their addiction. Nurses can use motivational interviewing to increase awareness and create a sense of urgency. Providing educational resources about addiction and its consequences can be helpful here. Contemplation. The patient is beginning to acknowledge their addiction but may feel ambivalent about change. Nurses should provide empathy and help the patient explore the pros and cons of changing their behavior. Referral to peer support groups or individual counseling can be beneficial. Preparation. The patient is planning to change. Nurses can help by creating a personalized treatment plan, setting short-term goals, and discussing available recovery resources such as inpatient care, outpatient treatment, or support groups. Action. The patient has started taking steps toward recovery. At this stage, nurses can provide ongoing encouragement, assess progress, and address any setbacks. They can also connect the patient with community-based services and support networks to maintain motivation. Maintenance. The patient is working to sustain recovery and prevent relapse. Nurses can focus on long-term recovery strategies and help the patient monitor triggers that may lead to relapse. Ongoing peer support and aftercare services are crucial at this stage. By tailoring interventions to each stage, nurses can effectively guide patients through the recovery process, helping them achieve long-term success. Describe the key principles behind recovery-oriented systems of care (ROSC) and how they can impact patient outcomes in addiction treatment. What role does a nurse play within ROSC? Answer. Recovery-oriented systems of care (ROSC) are designed to be comprehensive, patient-centered, and inclusive, emphasizing long-term recovery as a continuous process rather than a short-term goal. Key principles include patient-centered care. ROSC ensures that the treatment plan is individualized, respecting the patient's values, preferences, and goals. It places the patient at the center of decision-making, comprehensive and coordinated services. ROSC integrates multiple services: medical, psychological, social, and peer support, providing a holistic approach. This reduces fragmentation of care and ensures the patient receives comprehensive support. Sustained support. Recovery is viewed as a lifelong process. ROSC focuses on providing ongoing support through community-based resources, peer support networks, and long-term care plans. Strengths-based approach. ROSC emphasizes the strengths and capabilities of the individual rather than focusing solely on the deficits caused by addiction. The nurse plays a critical role in implementing ROSC principles. They assess the patient's needs, coordinate services, and facilitate access to medical and psychological support. Nurses also offer emotional support, provide education, and help connect the patient with recovery coaches and peer support services. By operating within ROSC, nurses ensure that addiction treatment does not end after detoxification or initial rehabilitation, but extends into sustained recovery through ongoing monitoring, support systems, and community involvement. Mr. Adams is a 45-year-old male with a 10-year history of opioid addiction. He has recently completed a 30-day inpatient rehab program, but is struggling with transitioning back to everyday life. His family has expressed concern about his potential relapse, and he feels isolated in his recovery. As an addictions nurse, what steps can you take to support Mr. Adams in this critical transition phase? Answer. In this scenario, Mr. Adams is likely in the action or maintenance stage of the trans-theoretical model, but faces challenges related to isolation and the risk of relapse. Several steps can be taken to support him during this transition. Develop a relapse prevention plan. Work with Mr. Adams to identify potential triggers and high-risk situations for relapse, such as social isolation, boredom, or stress. Community integration. Encourage participation in local recovery support groups such as Narcotics Anonymous, NA, or other peer-led groups. Having a sponsor or recovery coach can provide Mr. Adams with someone to call upon during moments of crisis. Family involvement. Educate Mr. Adams' family about addiction recovery, ensuring they understand the process and can provide non-judgmental support. Mental health support. Assess for co-occurring mental health issues like depression or anxiety, which are common in addiction recovery. Referral to mental health professionals or counseling can address these concerns. Follow-up care. Ensure that Mr. Adams has regular follow-up appointments, whether with an addiction counselor, psychiatrist, or primary care physician. Discuss the ethical and legal considerations nurses must be aware of when utilizing harm reduction strategies, such as needle exchange programs. How should nurses address concerns about legal and public health implications? Answer. Harm reduction strategies such as needle exchange programs aim to reduce the negative health consequences of substance abuse by providing clean needles to individuals who inject drugs. Nurses must navigate both ethical and legal challenges when engaging with these programs. Ethical considerations. Autonomy and non-judgment. Nurses must respect the autonomy of individuals in choosing to engage in harm reduction. This involves offering services in a non-judgmental and empathetic manner, focusing on health outcomes rather than moral judgments about drug use. Beneficence and non-maleficence. Nurses have a duty to promote the welfare of patients and prevent harm. Needle exchange programs reduce the spread of blood-borne diseases like HIV and hepatitis, promoting public health. Social justice. Nurses should advocate for marginalized populations, ensuring that those with addiction have equitable access to harm reduction resources. Legal considerations. State and federal laws. In some jurisdictions, needle exchange programs may face legal barriers or restrictions. Nurses must be aware of local public health laws and ensure that they are operating within the legal framework of their state or country. It is also important to monitor confidentiality and privacy laws, ensuring the protection of individuals' personal information in these programs. Liability issues. Nurses should be educated about the legal implications of their involvement in harm reduction services. Proper documentation and adherence to protocols are essential to mitigate legal risks. Public health implications. Community health. By engaging in harm reduction, nurses help reduce the incidence of infectious diseases and help individuals access treatment and support services. Nurses should educate the public about the benefits of harm reduction in preventing wider public health crises such as HIV outbreaks. ECA community-based prevention program aimed at reducing adolescent substance use. How can an addictions nurse contribute to the success of the program? Explain the nurse's role in outreach, education, and evaluation of the program. Answer: an addictions nurse plays a crucial role in community-based prevention programs designed to reduce adolescent substance use. Key contributions include outreach. Nurses can build trust within the community by establishing relationships with adolescents and their families. This involves engaging with local schools, youth organizations, and community centers to deliver targeted outreach about substance use prevention. Nurses should also work with school counselors and community leaders to identify at-risk youth and direct them to appropriate resources. Education. Nurses can design and deliver educational workshops that focus on the risks of substance use and provide skills for coping with peer pressure and stress. They can educate both adolescents and parents about the signs of substance use and the importance of early intervention. Evaluation. Nurses must actively participate in the evaluation of prevention programs to assess their effectiveness. This could involve collecting data on program attendance, participant feedback, and behavioral changes such as reductions in substance use. Nurses should use this data to refine and improve future programs, ensuring that interventions are culturally competent and evidence-based. What are the main principles behind holistic approaches in addiction recovery, such as yoga, meditation, and art therapy? How do these therapies complement traditional treatments in promoting long-term recovery? Answer: holistic approaches in addiction recovery, such as yoga, meditation, and art therapy, focus on treating the whole person, mind, body, and spirit. Rather than just addressing the addiction itself, these therapies complement traditional medical treatments by providing additional tools for emotional regulation, stress management, and self-expression. Yoga can help individuals in recovery reconnect with their bodies, reduce anxiety, and manage physical tension. It promotes mindfulness and self-awareness, which are critical in overcoming the psychological aspects of addiction. Yoga also supports relaxation and mental clarity, helping individuals build a sustainable recovery foundation. Meditation techniques such as mindfulness meditation or guided imagery teach individuals to stay present and reduce impulsive behaviors. It helps reduce cravings by promoting mental calmness and focus, which are essential for managing triggers and relapse. Art therapy. Art therapy encourages individuals to express emotions and experiences through creative outlets. This therapy is particularly useful for individuals who find it difficult to articulate feelings through words. It can promote emotional healing, reduce stress, and help clients confront past traumas that may contribute to their addiction. Discuss the concept of peer support in addiction recovery. How do peer support groups and recovery coaches aid in maintaining long-term sobriety? Answer: peer support is a critical component of addiction recovery as it connects individuals who are in recovery with others who have had similar experiences. Peer support groups such as Alcoholics Anonymous or Narcotics Anonymous offer a shared understanding of addiction and provide emotional and social support in a safe, non-judgmental environment. Recovery coaches are trained individuals who provide personalized support to those in recovery. They assist with goal setting, stress management, and overcoming setbacks. These coaches often help clients navigate recovery by offering practical advice and emotional support, as well as referring them to resources such as housing, employment, or educational programs. Both peer support groups and recovery coaches help build a supportive community, which is essential for maintaining long-term sobriety. By fostering accountability, social connections, and personal growth, peer support plays a vital role in preventing relapse and promoting sustained recovery. Explain how addiction nurses can advocate for public health initiatives aimed at addressing substance use issues in the broader community. What strategies can nurses use to influence policy and public perception of addiction? Answer: addiction nurses can advocate for public health initiatives by raising awareness of the social, economic, and health-related consequences of addiction. Key strategies for advocacy include policy advocacy. Nurses can work with policymakers to advocate for improved access to treatment, harm reduction services, and public health programs. This includes advocating for the establishment or expansion of substance use treatment centers, needle exchange programs, and overdose prevention initiatives. Public education and awareness. Nurses can educate the public about the nature of addiction and the benefits of treatment, working to reduce stigma and promote a more compassionate approach to those struggling with substance use. This can involve public speaking, community outreach, and collaborating with local media to disseminate information about addiction as a disease. Collaboration with advocacy groups. Nurses can join forces with organizations that lobby for substance use reforms, working alongside groups like the National Institute on Drug Abuse, NIDA, or Addiction Policy Forum can amplify their advocacy efforts. How do prevention and public health approaches aim to reduce substance use in at-risk populations? Provide examples of community and school-based prevention programs that can be effective. Answer: prevention and public health approaches aim to reduce substance use by addressing the root causes of addiction, such as social, psychological, and environmental factors. By focusing on education, early intervention, and social support, these approaches aim to prevent the initiation of substance use and reduce its prevalence. Community-based prevention programs often focus on building resilience, offering alternative activities, and strengthening social bonds. For example, youth programs that teach life skills, coping mechanisms, and resistance to peer pressure have proven effective. School-based prevention programs can be integrated into the curriculum, focusing on drug education, life skills development, and creating a supportive school environment. Programs like DARE, drug abuse resistance education, or life skills training provide students with strategies to resist peer pressure and make healthy decisions. Both types of programs aim to change social norms and reduce the likelihood of early substance use by equipping individuals with knowledge and skills to make informed decisions. Explain the significance of stigma reduction in addiction recovery. How can addiction nurses help reduce stigma and improve public perception of those suffering from addiction? Answer: stigma surrounding addiction can prevent individuals from seeking help, worsening their condition and prolonging their suffering. Stigma often arises from the belief that addiction is a moral failing rather than a chronic disease. This misconception can lead to discrimination and marginalization of those in recovery. Addiction nurses play a pivotal role in reducing stigma by educating the public. Nurses can provide education to patients, families, and the community about addiction as a disease, modeling compassionate care. By showing empathy and respect to patients, nurses set a standard for others to follow. Non-judgmental, person-centered care can change how society views those struggling with addiction. Advocating for policy change. Nurses can advocate for laws and policies that reduce discrimination against those in recovery, ensuring they have access to employment, housing, and treatment without facing bias. Peer support and recovery coaches. By promoting peer-led support, nurses can demonstrate that recovery is possible, further changing perceptions of those with addiction.